Prostatitis is a very common condition. It's one of the main things I see in my office each week. It is an inflammatory condition of the prostate and the pelvis. It can be both bacterial and non-bacterial. Prostatitis is diagnosed typically by history and physical exam. The most common complaints that most of my men come with is just pain or discomfort in the pelvis. It's not a bad pain, it's more of a nagging, annoying pain. And it can come and go. In most guys, it's been persistent for several weeks to even months. And a lot of men have actually seen the primary doctor and been given antibiotics. And it may get better, then it comes back again. We diagnose it by exam. We do a prostate exam to feel the prostate. Is it inflamed? Is it irritated? Is one side different than the other? The other is we get a culture of the ejaculate fluid to see if there's any bacteria growing in this. This could be performed in various manners, but generally we want to see if there's any bacteria in the ejaculate fluid, which is really just all made by the prostate. There are two classifications of prostatitis: bacterial prostatitis and abacterial prostatitis. Bacterial prostatitis is caused by a bacteria. Most of these bacteria are commonly bacteria that live on our skin. All men and women, if I was to culture their inner thigh, we would usually find these bacteria. However, they do get into the prostate and they cause this low-grade inflammation. They're not bad bugs, that's why we don't get really sick. However, some of them can cause severe sickness. These are not STDs, they're not communicable. You can't give them to your sexual partner. That's something I tell all my men, this is very important to remember. Abacterial prostatitis is an inflammatory process of the prostate, not caused by a bacteria. A lot of times we don't know why people develop this. I believe that all abacterial prostatitis stems from bacteria at some point in that man's history. However, they have a persistent inflammatory process in the prostate, even though there are no active bacteria in the prostate. And this is one of the more difficult conditions to treat. Prostatitis is not prostate cancer. Fortunately, or unfortunately, most prostate cancer is asymptomatic, whereas prostatitis has symptoms. However, there is some data that suggests that chronic inflammation of the prostate can lead to prostate cancer. In general, we don't consider a history of prostatitis to be a risk factor. However, men who've had long histories of prostatitis, we are a little more concerned that they could develop prostate cancer in the future, therefore requiring just more active surveillance in these guys. Bacterial prostatitis is caused by a bacteria, and this is treated with antibiotics. We have to treat the prostate for several weeks because the antibiotics take a while to get deep within the prostate. The bacteria come from the inside out. They come from the urethra, which is in the center of the prostate, and then go out. The antibiotics come from the outside in. So a lot of times what we see is men have been treated with prostatitis appropriately, but just not long enough. So those bacteria are able to hide deep in the prostate, away from the antibiotics. Therefore, the symptoms do go away for a while, then as those bacteria grow, and the symptoms return. So it's a cyclical cycle. So a lot of men, we have to do a prolonged treatment to make sure we saturate the entire prostate. A lot of times the treatments are targeted on that individual's symptoms. Sometimes it's inflammation, so we use drugs to minimize the inflammation. Sometimes it's pelvic tone or muscle tightening in the pelvis. It could be in the pelvis or the prostate, so we use different drugs there. Sometimes they have a neuritis or an inflamed sensory nerves where they have an upregulation of what they're sensing, meaning things they shouldn't be bothering them, bother them. So therefore we use drugs to address that. Sometimes we need to use physical therapy or even acupuncture to help some men overcome this debilitating problem. The most common question I get is, why did I get this? Or how can I keep from it happening again? And to be honest, I really don't know. It's not because hygiene in most men. It's not because one man's circumcised or uncircumcised, although these can be risk factors. Most of these men have no really abnormal history. They're just normal guys, and they just happen to get this problem.